Hey everybody, this is Dan with Pain Free You. Today I have the pleasure of speaking with Dr. Kurt Christensen from Utah. And he and I have connected a little bit over the past year or so, maybe a little bit longer, with some comments and messages. And he decided to share his story to hopefully inspire somebody or give somebody some insight as to what worked for him. So, Kurt, I appreciate you. Pleasure to meet you in person. It's the first time we're speaking. So it's a pleasure.
It's great to see you, Dan. And of course, as we've discussed over the months, I really appreciate the good work that you're doing.
Thank you so much. So this is a casual conversation among friends and just, if you're sitting here across from the table having a coffee or a beer with me, tell me about your journey with chronic symptoms, learning about this mind-body space, what you did in that area, and what kind of helped you make the turn and got better yourself. And also, I know you mentioned that you share a lot of this information with the people who come through your practice as well. So if you want to touch on that as to how you're trying to spread the word, that's cool too. But yeah, so welcome to the call and tell me a story.
Thanks, Dan. No, great. First, I probably ought to clarify that I'm a pediatric dental provider. I'm a dentist,
Okay.
so I don't want to portray myself as anything other
Medical.
than a guy who fixes kids' teeth.
That's
But
okay.
yeah. How do you really, in a short period of time, discuss a 17-year journey, learning about, understanding, and ultimately accepting TMS as the correct diagnosis for physical things? I always think of what Dr. Sarno once said. I get all this criticism for this silly concept that maybe the mind and the body are intimately connected.
Hmm.
And so I found Dr. John Sarno's book, Healing Back Pain, given to me by my brother, probably close to 17 years ago, as I was dealing with some chronic back pain. Most
Sure.
most dentists most dentists do. And you're told as a dentist in dental school, actually as a student, you're probably going to develop back pain because of
You're bent over.
your posture during the day. And then having been diagnosed with scoliosis as a kid, I began to seeds were being planted that maybe I was going to be a back pain sufferer. And
Sure.
and we can talk more about those seeds that get planted.
Yeah.
uh, and sometimes the conditioning, unconscious conditioning that we get about what physical symptoms we could or might or are likely to develop. Um, but I developed some back pain. It became severe enough that I actually wondered if I was going to need to go on disability.
Wow.
I as often these symptoms do, it began with an injury. I was replacing a battery on a car. They're not light. And I remember feeling a pop in my back.
Hmm.
And then it progressed to a pretty severe case of sciatica.
Hmm.
And I still remember filling out papers, disability papers with my insurance carrier that I was no longer going to be able to practice. Um, and I was given the book about that time, Healing Back Pain. And I noticed that your last conversation was about, do success stories irritate or inspire you? I don't want to irritate anyone by saying that just intuitively, as I read that book, I just kind of intuitively understood, and I'll talk more about that later, that
Hmm.
this could definitely apply to me.
Sure.
And I probably within um, probably I want to be accurate because I don't want to irritate anybody, but probably within a month and a half, I noticed a significant improvement enough.
Awesome.
Um, Certainly not a miraculous cure, but I thought this is a lot better than any other modality that had been using. Those modalities, of course, were physical therapy, chiropractics, obviously pain medicines. I thought I was on my way to some healing. I didn't know that I would totally get rid of it
Hmm.
uh, and heal 100%, which I eventually did. But it took some time, Dan.
Sure.
Uh, and then of course the symptom imperative. I must be a classic TMSer because I experienced it in other ways through a case of prostatitis, which was treated as an infection. Um, but we're now really beginning to understand that it's just kind of um, a migraine of the pelvic region. Of course, I was associating it again with my posture as a dentist, sitting in the chair all day. Um, Overcame that, and then was really grabbed by COVID in 2020. November, I contracted what I think it was the original virus, which,
Hmm.
not to get too, I know people have a lot of opinions on this, and I think the original probably carried a little bit more pop than the variants that followed it. Um, and I got really sick. And once again, I started having seeds planted in my mind about this uh, long COVID situation. And again, whether I don't know why I tend to sometimes catastrophize situations in my mind, but I thought to myself, am I going to be that guy? I certainly wouldn't have associated it as a TMS equivalent.
Sure.
Um, but yes, my symptoms lasted, and they lasted uh, uh, almost a year until I finally connected the dots again, that this might be a mind body
Hmm.
disorder. And once I made that connection, um, I proceeded to heal pretty quickly.
Nice.
Listen, I just tried to condense 15 to 17
Oh, that's
years.
great.
So
Yeah. So the long COVID, obviously, or the what is proposed to be long COVID, in my opinion, is all TMS. It's all perceived danger creating those symptoms. And I view catching COVID as the scare event, not necessarily that you had a year worth of symptoms because the virus was still active, right? The scare event creates the perception of danger. And then the seed was planted when you started hearing about this thing called long COVID that people are talking about. Now, all of a sudden, people are more afraid of long COVID than they are of actually getting sick in the first place. And so that creates a perfect storm of people coming down with a whole host of symptoms, especially when they start looking at, oh wow, look at all those symptoms. Well, they perfectly match a list of mind-body symptoms.
yeah, you know what was funny, Dan? You talk about um, um, finally just accepting TMS as the cause of symptoms, getting to that place mentally, emotionally, spiritually, however you want to. It was definitely it was definitely when I one day heard that whatever agent was it, the CDC, and I don't want to disparage any organizations. I know everyone's doing the best they can with how they were trained and how
Mhm.
they perceive things. But when I heard there were officially 125 different long COVID symptoms,
Yeah.
that's when just logically in my mind said, okay, I now know what this is. I could hear Dr. John Sarno, who was with a patient, and he did a small little video, and he said something to the effect, there is no way that all your symptoms could be caused by this simple abnormality that we see on some imaging. So
I
that's when
agree.
it really began to click. And instead of thinking physical, what should I be doing? And I was doing some things physically to overcome long COVID. That's when I said I got to start thinking emotionally and mentally, kind of dive in for a minute.
Mhm.
And when I did that, I'm really fortunate to say that I've been symptom free of long COVID for now almost 2 years.
That's awesome. Okay. And I always hesitate to say you're symptom free from long COVID because you didn't have long COVID.
There you
COVID,
go. Okay, fair,
COVID
fair,
was a trigger
fair
event.
correction.
Right. And I like to clarify that because
Oh,
I
it's
deal
good.
with a lot of people who understand the mind-body connection. They understand that their symptoms are TMS, but they keep on saying, but I have long COVID, I have long COVID, I have long COVID, I have long COVID. And I'm saying, do you? Or do you have perceived danger symptoms like TMS? And it's really important because if you keep on identifying with long COVID, you're carrying around that list of 125 symptoms with you. And the fact that all the professionals out there are saying, well, we're still studying it. We don't understand it completely yet. So we don't have a solution for it yet. So I have a real strong urge to separate us from the medical diagnosis once we make the connection and say, okay, that's what this is. Now, I
Yes.
was just at a workshop for the PPPD Association and PPD Association. And it's basically a whole mind body community. It's Dr. Schubner, Schechter, Strax,
I'd love
Clark,
to
and all
go.
those guys. And it was stated emphatically from the stage, from more than one of the presenters, that long COVID is TMS. It is a mind body condition. And that's why I referred to COVID as the scare event more so than the physiological trigger that caused a cascading failure of the body. It doesn't, it's not that. Um,
My my COVID, not to interrupt you, because I completely agree. And I won't make that mistake again, Dan, in the
it's
next.
okay. I'm
No,
not correcting you. I'm just
I
making sure
know.
the audience is hearing it.
Please know that I'm a sarcastic person, but um, the COVID was the scare event, like the battery incident.
Mhm.
Uh, Fixing my car was the event that triggered the symptoms that followed.
Let's talk about the car event.
Okay.
You injured it picking up a battery.
Mhm.
What was the evidence of the injury besides the pain?
Great question. I got an MRI.
And
Uh, I had three herniated discs
okay,
with fragmentation, which actually means that the material within the discs had separated. And they also saw that my S1 nerve was being rerouted by some of this anatomical uh, these
sure.
anatomical abnormalities.
Yeah.
Um,
So
and
what's the proof that that all happened when you picked up a battery, or was it from years of bending over patients?
zero.
Good. That's what I'm getting to because we all refer to our injury, which is the onset of symptoms.
Right.
And, it very well may have been a true injury where in that moment something shifted in your body. But that also falls in line with Dr. Sarno's normal abnormalities. We don't know if you've been bending over patients for a lot of years. It's possible that was just the normal wear and tear on your spine due to the postural and professional requirements. Um, but an acute onset of pain often feels like an injury, but it could just be an acute onset of the brain perceiving danger and saying, "Whoa," because you said you were primed for back pain since dental school.
Day one.
Day one. And so now all of a sudden, your brain, who's doing its job to protect you and keep you safe, sees you lifting up this heavy car battery and
Yeah,
it said, "Stop it."
that's right.
This is theory. I don't know. You don't know. I'm just suggesting that what feels like injuries, we don't know. Could have just been the brain warning you acutely, and that started a cascade of symptoms that lasted you for a while until you dug into the book and were intuitive enough to say, "Yep, this is what's going on," and you recovered from that.
Yeah,
So just question the whole injury.
we also have the evidence, of course, of people who haven't had back pain get MRIs, and the majority of them have some abnormality that if there had been an event that caused some pain and they had gone to see the doctor, it likely would have been connected as the cause of the
Right.
pain, when in fact it predated any injury.
Yeah. So, I mean, I think the most important thing to do is say, how are my symptoms behaving now? Right? Because regardless of the onset, 15, 17 years ago, if you were still dealing with back pain, I'd say that incident doesn't matter. It was the scare event that started the pain. They found something, they pointed to it and says, "Oh, look, look, look." And then all of a sudden it was like, wow. Well, if that was truly the case, did you have surgery or anything or no?
I was scheduled for surgery. Yeah, you bet. I was told by a surgeon who I respect greatly here in the community that I needed back surgery. Go ahead. Did you have a question?
Well, no, I'm like chomping at the bit to point out that you got better without surgery, which meant those were normal abnormalities that were not the cause of the pain. Because if it was the cause of the pain, Sarno's work wouldn't have helped.
That's right. Yeah, I ran into that surgeon at a golf tournament, ironically, probably a year and a half after he wanted to operate, and asked how I was feeling, and I said, I'm 100% better, symptom free, and I'll never forget his response. He said, "Wow, Kurt, you're so blessed genetically." As a former athlete, I did play some college, 4 years of Division I college basketball,
Right.
and I guess he assumed that maybe it was somehow my athletic ability that allowed me to overcome uh, our 3 herniated discs. But not to make light of that. Um, yeah, I got better, and I think I've talked about on a previous podcast with another mind body expert. Um, I talked about the ABCs. I don't know if I've borrowed this. I've read so many books and listened to so many things. I don't know if I'm plagiarizing, but
That's okay.
for me, the ABC model works well, and it's what I use with my patients. Um, of course, in school, if we get an A grade, that's the best. If we get B, it's good, and supposedly C means average. See if you can just begin to conceive that there might be a connection between your emotions and your symptoms, pain. That's You're on your way.
Yeah.
B, if you can start to believe that this connection uh, is real and the cause of your symptoms, that's really good. But it's not until you get to accept, um,
Mhm.
absolutely accept the reality that your symptoms, whatever they are, and
Mhm.
Dan, I see symptoms every day of TMS.
I'm sure.
And it's so hard for me not to just jump in. But
All the
it,
parents bringing the kids in, right?
yeah, and we can talk a little bit about what I'm seeing in children and teenagers today, because it's exploding.
Yeah.
Yeah, but if you can get to the point where you just accept that you have nothing to be afraid of, there is nothing to be fixed, and that as you dial down the fear, um,
Hmm.
and resume as much as possible normal activity,
Yep.
and not give attention to the symptoms, that you will get to. This is brain science. It's not a, you said theory. Okay, I'll accept the word theory, but I believe that this brain science has now been proved and proved again enough in my own life and in the lives of my patients, that TMS is often the right diagnosis.
Yeah. Yeah. I mean, I see it daily.
It's
All the
unbelievable.
YouTube, Facebook comments, people saying, "Oh, I got better," or "I'm getting better," or I think you'll be like success story, full length interview 91, right? So, this stuff isn't just concepts. This isn't like wishful thinking. It's proven. And there are wonderful scientists and medical doctors and therapists that are now involved in seeking out clinical trials. They did the Boulder back pain study, which was a full-blown, proper documentation clinical trial. And it was remarkable at how well this approach handled the people who were part of the trial. So this is, you're right, it is science-based. This is not airy-fairy new age wishful thinking.
No. And as I introduced the concept, of course, in dentistry, the TMS equivalents that I see the most are atypical facial pain,
Mhm.
migraine, and what the population calls TMJ,
Sure.
which is actually TMD, temporomandibular disorder or dysfunction, where TMJ is just the joint. But I'm seeing all kinds of clusters of symptoms that these young people are living in a very contentious, um, never-ending, pressurized world with social media, things that you and I didn't have to deal with as kids, and that autonomic nervous system never gets turned off. You and I turned it off at 4:30 when school was over, and you and I went home and rode our bikes outside and played baseball and climbed
Yeah,
trees. And now they go home and look at their phones for 4 hours and play video games till midnight, and that brain just never gets turned off.
sure.
And it's fertile ground for TMS in children. And without boring your listeners, the success that I'm seeing is way more rewarding than even the dentistry that I'm doing.
Right.
It helps kids.
Yeah. So, I mean, you're coming in with people who have, jaw pain, facial pain, migraines. And of course, they're looking at you going, you did this. You hurt me, right? Because it happens soon after the dental work.
Well, not all actually in
Sometimes
yeah, it's sometimes, but the vast majority of cases, these kids just develop these symptoms over time.
before they got to you.
Right. And that's when I close the door and I sit down and ask questions that a dentist doesn't normally ask,
Yeah.
like, what's going on in your life right now?
Yeah.
Of course, mom and dad or guardian are always in the room with us
Yeah.
as they're minors. And it's remarkable how the patient then, and the predilection, I don't want to get into gender too much, but I probably see uh, girls to boys maybe 4-to-1.
Wow.
Uh, and so, but when I ask the question, it's always interesting when the patient becomes quiet, and then often there are some tears. And then I look at mom and dad, and their jaws drop because they have no idea of the emotional turmoil, the fear, the loneliness, the sadness, the
Yeah.
anger, the rage that exists within their child who doesn't openly display those things.
That's some heavy stuff.
It is heavy. It's the human condition,
Yeah.
and I'm gradually seeing us, at least the medical paradigm, shifting towards at least an openness to the idea that emotion could be driving our chronic symptoms. And I'm talking about almost every symptom there is out there. Um, with full disclosure, of course, we need to, in case of migraines and consistent headaches, it is very wise to rule out medically more serious conditions. We always recommend that.
Yeah.
That is done through MRIs and
Hmm.
such.
I
And
agree.
when those tests come back negative or indecisive, um, that's when we can uh,
Yeah.
start to see, and work towards an A grade, and accept the TMS as the correct diagnosis.
Yeah. I mean, that's pretty consistent. Dr. Schubner, for example, his rule of thumb is rule out the serious stuff, the cancers, the tumors, fractures if you've got body pains, infections, because you don't know. I mean, sometimes we can have an unknown infection. So let's rule out the biggie medical stuff, the life-threatening stuff, the significant stuff, and then we rule in the mind-body condition.
Yeah.
And by doing that, the stuff in the middle are the incidental findings that are often blamed for the symptoms, but not the actual cause. So I think you're right, and I'm glad you mentioned ruling out the big stuff. So that's great.
Yes. What I think is remarkable is I just saw, we'll call her Kate. Kate is a 17-year-old girl who suffered migraine headaches, debilitating migraine headaches since she was 13.
Wow.
She she came to me for a routine dental visit, not expecting to eventually be introduced to the ideas that would help her
Right.
cure at the dentist. Because by that time they had spent well over $20,000 seeing multiple specialists. They would get her, they would get an MRI, it'd come back normal, and they couldn't accept that things were normal.
Right.
So they went to another specialist
Hmm.
and they couldn't accept that the results were normal. And I think it's interesting that we're a percentage of the population. It's easier for them to not believe that things are okay than to believe that things are okay. Um,
Yeah.
and it's an interesting dichotomy.
Yeah. Now you mentioned, you are leaning towards emotions as really the cause, and that's very much a Sarno belief system. And I've taken it a step higher. Emotions can definitely be the cause of these conditions. I take it a step higher, perceived danger of any type,
Mhm.
right? And so, was your long COVID really created by emotions? Maybe fear, for sure, of
Mhm.
this perhaps long COVID thing and catching that or getting that. Um, but there can be all sorts of perceived dangers. There are people with no emotional um, chaos going on in their life. They have a medical treatment, and then that was, I like the word scare event that just kind of tipped things over. So,
Are you suggesting that there were any scare events related to COVID, Dan?
um,
I'm
maybe.
being I'm being sarcastic.
Well, it could be. Yeah.
Yeah,
Just turn on the news station anywhere on the globe for 4 years, and
yeah,
now it's news about long COVID. So
right.
it's very much it's always out there. It's in your face. Everybody knows somebody with long COVID. And when you look at the list of symptoms, they're the same list of symptoms that are on any mind body website. So it is truly that. And the proof is in the pudding. We're seeing recovery after recovery after recovery using
Wonderful.
mind body, teach your brain you're safe, accepting that you're not sick. You got better. So many other people are getting better. So I don't believe this is a viral thing.
No,
The event of getting sick is what kicked it off, but I don't think people are sick months, years
right.
later because of some virus still present.
No, post-viral syndrome is an accepted theory in medicine, and I think that's what we're seeing. This is a post-viral syndrome that has nothing to do with the original virus. Um, and it's well documented now. You know what else I find troubling, Dan, is when I sit down to watch the World Series or TV, is the onslaught of pharmaceutical commercials. We're one of I don't want to misspeak, but I think we are one of just a few countries in the world who actually allow uh, pharmaceutical companies to advertise
Sure.
their products with a whole list of symptoms. Um,
Yep.
and I call that the seed planting, the conditioning,
Mhm.
that the minute you may begin to have a symptom or two, you know that there's a pill that might be able to that you have a diagnosis of X and a pill to treat X. I think that's part of the conditioning that's going on within our country that is um, is unfortunate.
Yeah, and then you get then you get patients walking into doctor's office going, "I need this." They've self-diagnosed and they've self-prescribed and said, I need this. And when the doctor says, well, no, let's step back and see if that makes sense. They're like, but no, I need this.
That's
And
right.
some patients actually come into doctor's office demanding treatment, and a doctor is sometimes left reluctantly administering that treatment because they
Right.
want to help. The patient believes that will help. And, it's a tough situation. So I love that you're a medical practitioner. You are aware of these things. You are sharing with your patients. You are helping your patients with this insight. And so, you know, I imagine you're also talking to your colleagues too and sharing some of this.
I am. I do. And, I do experience something similar to what Dr. Sarno did all those years ago. Although I do believe it's getting better. People are more open to this idea. And largely because um, they 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 haven't seen the success uh, with patients dealing with chronic symptoms, and so they know that what has been prescribed in the past is not working. They're almost forced to be open to new modalities, new ideas on helping people to get better.
Right.
Uh, and the crazy notion that the mind and the body are intimately connected.
Yeah.
Uh, what a simple premise, but what a powerful one.
I actually have a slightly different twist on that. They're
Tell
not
me.
they're not connected. They're one system.
Fine with that. I'm fine with
It's one system.
yeah.
You can't have an emotion without feeling it in your body. That doesn't mean it's a connection. It's one organism.
I like that. And I agree.
So,
Yeah.
um, any words of advice for people who are on this journey who might be struggling with the ABCs,
Yeah.
conceiving that it's possible, believing that that could work for them, but ultimately accepting. I love that framework that you've given. Uh,
Mhm.
but any other thoughts for somebody who's struggling? Because there's a lot of people who know about TMS, mind body. They believe it applies to them, but they're still terrified of being terrified, and they don't think they can get out of it. They don't believe that they can get better because
Yeah.
I've been anxious my whole life. So, any thought towards that individual who just knows what's going on, but is still going, but I don't know.
Yeah. I have
It
so
hurts
many
so
thoughts.
bad.
That's right. I have so many thoughts and I don't know how to organize them in a way to be effective here, but I'll try. Um, Healing is my experience and with the experience of my patients, healing is never linear.
Right.
It's concentric circles. It's switchbacks on a mountain.
Hmm.
It's with setbacks. Uh,
Yes.
so my expectation was always that, like with an antibiotic and an infection, I could get on an antibiotic and day two was better than day one, and day three was better than day two, and day four was better than day three. Antibiotics are amazing that way. They
Right.
work the vast majority. And so we're taught to believe, conditioned to believe that healing, wow, it's linear improvement.
Yeah, not this.
To address your listeners who I may be irritating right now, and I understand that irritation. I I've lived it and experienced it myself, but I would just tell them to expect setbacks and switchbacks on a mountain. Nothing is linear, straight up, and that a whole lot of patience and extending some self-compassion throughout
Yep.
the process. I'm a big believer, especially in males. Um, and again, I don't want to draw too many definitive lines around gender and uh,
Hmm.
but it does seem that men have a harder time extending themselves a little bit of patience and self-compassion and understanding. Um,
Yeah, I see it on both sides with the coaching clients I've got. There are just as many self-critical people on both sides of the gender aisle.
yeah, yeah, and that's why I don't like to draw too many lines there. But um, And I would just say as you want to get from C to A, you're gonna need evidence.
Hmm.
Gonna need evidence, but the evidence will come. You just need to write it down and remember.
Yeah.
I remember all those years ago when I was dealing with back pain, I went to a concert with a friend and a brother, an old 80s band that I loved. And of course, the the crowds are always smaller with these 80s bands. So you can get real close to the stage. And I remember just being totally caught up in the good music uh, and the environment there that 45 minutes later, I walked out and I said, well, my back didn't hurt. My sciatica went from a 10 to a 1. What did I just experience? And well, yes, what I experienced was my focus and concentration left my physical symptoms.
Yeah.
I and so little things like that, and it'll present itself differently in the lives of your patients, Dan, the people you're helping.
Yeah.
But when it happens, document it, write it down,
Hmm.
because we tend to forget these evidences.
Sure.
And as the evidence begins to uh, amass, then it's easier to go from conceive to believe, and
Sure.
then ultimately from believe to accept. Did that make sense? Do you agree with that, Dan?
I absolutely do. And I talk about, keeping a log of your progress and wins, um, and refer to it anytime you're struggling. If symptoms are kicking your butt today, pull out your evidence log. There's your proof.
Mhm.
Because anytime, people are like, when I'm feeling good, it's easy to believe this stuff. When I have a bad day, doubt comes rushing back in and I jump back onto the computer and I start looking at my MRIs again. And, so the key is you got to know what's causing symptoms. Does it apply to you? And then make a decision to accept that. And I talk about that. I did a 4 stages to recovery. Understand, assess, accept. And then the last step is teach. Teach your scared brain that you're actually okay. And that's by the things we do, think, say, how we behave, engaging more in life. The reason you felt better at that concert is because your brain was like, "Ah, look at Kurt, he's safe. He's having
Yep.
fun, rocking out to some music. He's not thinking about or focused on or worried about his body. I guess he's okay. Safety brought the symptoms down." So I always look at it as perceived danger, safety, kind of simplify it at that highest level. Um, and Sarno's right. Emotions are one of the perceived dangers, but there's lots of stuff.
Yeah, no, I love that clarification and simplification of perceived danger. I was just talking to a cosmetic surgeon friend of mine who we were at a wedding, and he I could tell he was sitting funny in his seat at the wedding dinner. And
Hmm.
I said, "Hey, what's going on?" And he says, I'm just scared to death that my back pain is going to get to the point where I can't practice anymore.
Yep.
And um, what's fun is that was not only 2 or 3 months ago, and I just recently got a text. Of course, I took time then to explain in very basic terms what we're dealing with, and I had him buy Dr. Sarno's book.
Hmm.
Uh, and it's funny because the reaction now is more anger than anything else, that as a doctor he couldn't have figured this out on his own, but now he says it's from a 10 to a 3 in a short amount of time.
It's fantastic.
So the fact that you hone in, that you focus in on the fear, and dialing it down as the way to get better is I think really effective, especially for those who aren't who haven't gone to medical school and who haven't don't have the general idea of medical concepts. I think focusing in on the fear as at the lowest and highest levels is really effective, Dan.
Well, again, I think it's based on what's causing the symptoms. If the brain perceiving danger is turning on the alarm system with accurate knowledge and lowering the fear, the perceived danger is no longer there. And
Yeah,
so,
it's funny. I think people have been afraid of things for so long that they're no longer even aware of their fear. It's like asking a fish what it feels like to be wet.
yeah,
Sorry, that's kind of
I know.
a, a stupid example, but the fish doesn't know it's wet because it's been swimming in water its entire life. People have been swimming in fear their entire life, and or at least years when it comes to physical symptoms, and they need to be rattled and become aware of what they're actually feeling. I think John Sarno just articulated that by um, when he said, "Take your feet out of the physical and put them both firmly in the emotional
Yeah,
and
psychological. Yeah.
psychological, and then you'll start to see some of the magic happen."
Yeah, I like the concept that you're talking about. People have been afraid most of their lives,
Mhm.
emotionally, physically, socially, whatever it may be, that they don't realize it. They don't even recognize that they've been living in that state of fear for so long. Um, I saw a really interesting clip literally just this morning where somebody was saying, he was asked, "Do you feel stressed?" And he was like, "No, I don't feel stressed." And then they said, "Okay, but do you feel calm?" And he goes, "Oh, calm? No." So he's so used to the stress and the
Yeah,
feeling of being stressed that he didn't realize he's nowhere near calm. So we can take that same story and apply it to, a lot of people say, "I don't fear the pain. I'm not in fear." But do you feel safe? Probably not.
no,
So we
that's
want to create safety proactively because people say, "I'm not afraid of the pain. I'm just pissed off about it." And I'm saying, but is being pissed off about it creating safety, or is that reinforcing danger?
no, that's so true. I see that playing out in the lives of these young people on a daily basis. I'm good. I'm good. Um, I'm not this. I'm not that. Well, are you joyful? Are you calm?
Yeah,
Are you relaxed? Are you good in your skin? No. Who is
right.
the response. And so I think that's really important. Um, yeah, this is really fun, Dan. I'm excited for your book to come out.
Me too. December.
Congratulations and well done on all that work. You know, we communicating these things. We only have words. We only have language.
Mhm.
Um, I do think there is a gap that needs to be bridged by things by something beyond language. Um, and I think that you could call it intuition. You could call it epiphany, enlightenment, revelation, inspiration, whatever you want to call it. Um, but that little gap does need to be bridged by each individual. Um,
Yeah.
and I think you're as good a teacher on this subject, and I've listened to them all. You're as good a teacher as there is out there. So congratulations on the book.
Thank you so much. Yeah, you're saying that enlightenment, that realization, and I'll jokingly refer to it as the holy shit moment,
There you go. I
which is
like.
your A for acceptance, but the holy shit moment is holy shit, I'm actually okay.
Yeah.
And so, acceptance is a proper word, but I call it the holy shit moment. And because people will eventually get there. And,
Yeah.
and it's that moment that things start getting easier. I won't ever say this is easy, but it gets easier once you get to that point of accepting, like, wow, I'm really okay. These are false alarms. There's no fire in the building. So I know you've got an agenda. You're heading out to a World Series game. So, and I know you
Yeah.
said you only had a certain amount of time this morning. So I'm going to let you roll. I hope you catch a fly ball or something.
Yeah, it's gonna be exciting. I've been a Dodger fan since I was a little kid, and the Yankees and the Dodgers. I mean, that's an epic matchup with two of the greatest players of all time, in Ohtani and Judge, and
Yeah.
so I have to go.
Have a
Uh,
blast. I'm sure we could talk all morning exactly, but have a blast. I really appreciate you taking your time to do this. I think you've shared some insights from a medical practitioner standpoint and how you witness and see this stuff all the time with your patients. And so I really appreciate you. Thank you so much.
and
Like,
thank you, Dan. But just before leaving, I just know there might be a listener today, um, who is thinking, I can't go another day. That is the person I want to talk to today.
yeah,
Patience, self-compassion, gather evidence, and then apply more patience and self-compassion.
yes,
And you will live another day because you've lived all the other days previous to this one.
yeah,
And you will get better. I promise.
love that. Yeah, people have 100% track record of making it through every bad day. They'll
Amen.
make it through today as well. So I really appreciate you wrapping it up with that.
You're the best, Dan Buglio. Thanks so much.
All right, Kurt, I appreciate you. Real pleasure speaking to you live
Appreciate,
and
appreciate you.
enjoy the World Series.
Go Dodgers.
All right, man. Take care of
Thanks.
yourself. All
See
right.
you.